Several African countries are facing cholera outbreaks. The Africa Centers for Disease Control and Prevention is working to procure vaccines amid a global supply shortage. CGTN's Nick Mudima takes a look at some of the affected countries.
27,300 new cholera cases in Africa, with 687 deaths in 5 African countries since the beginning of the year, and the numbers are steadily rising, according to Africa Center for Disease Control. The majority of the new cholera cases are in Malawi in Southern Africa. 3,577 new cases have been reported there, with 111 deaths in the past week alone. The World Health Organization warns climate change may increase the frequency of cholera epidemics, given that the cholera-causing bacteria may multiply more quickly in warmer water. In West Africa, Nigeria has been experiencing significant flooding. There was a major cholera outbreak throughout most of 2022. Neighboring country Cameroon is also witnessing a fresh wave of cholera on its flooded northern border to Nigeria and Chad. As of January 5th, there's been over 15,000 suspected cases, including some 1,800 laboratory-confirmed cases. More than 300 deaths have been recorded since the outbreak was reported in October last year. Cameroon's health ministry said there were probably many uncounted cases in inaccessible villages in the flooded region. Other countries that are battling sporadic cholera outbreaks include Kenya, Mozambique, DR Congo, Niger, and Sudan. The Africa CDC is working with 2 local vaccine manufacturers to explore if the facilities can be repurposed to manufacture cholera vaccines. Nick Mudimba, CGTN, Nairobi.
Well, for more on this, let's now speak to Dan Banda. He is the head of health at the Malawi Red Cross, joining us live from Lilongwe via Zoom. Dan, welcome to the program. Thank you for joining us here on Africa Live. Dan, can you give us an update on the cholera outbreak situation in the country right now? Dan?
Thank you very much. Indeed, the situation of cholera in Malawi continues to rise. Since the first case in February last year, it's almost 12 months down the line, but we have seen the number of cases still continuing. So on average, currently, we are having almost about 600 cases in 24 hours, like new cases. But and cumulatively, right now, we have 36,000 cases since the start of the outbreak. The bad thing of it is that the case fatality continues to rise. As of now, we have more than 1,000 deaths cumulatively, and also case fatality of 3.3%, which is far beyond the WHO threshold of at least less than 1%. So the country is still struggling with the situation, and a number of admissions or a number of cases requiring admissions, like in a day, we are mainly having 800 and something cases in a day. So this continues to rise, and the government health system continues to be very much overstretched due to burden in the number in the health workforce, and also even the systems. We have seen a number of health facilities being closed just to accommodate the number of increasing admissions rising from increased cases of cholera. So briefly, that's what I can say in terms of the cholera situation in the country.
All right, Dan, as you've mentioned, the cases have multiplied, the death cases have multiplied within the last month, and the disease is putting millions of people at risk. Dan, what are some of the country's most pressing needs, though, at the moment as it tackles what has been described as the country's worst outbreak?
Yeah, so the most pressing needs at the moment, because we are now seeing a lot of cases coming in for requiring for admissions. So case management has been on the need because of in terms of infrastructure, as well as medical supplies and equipment, which is required each and every day. But it also in terms of prevention, we are seeing that maybe increased risk communication and community engagement is one of the pressing needs at the moment, especially looking at community engagement and coordination of efforts at community level so that we interrupt the transmission of the disease at that level. So basically, looking at the preparedness or prevention activities through a network of volunteers and also coordination with community leaders and all influencers from the community level can also help in decongesting the health facilities as one way of reducing the cases that are requiring case management.
All right, Dan.
But maybe in the long run, we are also looking at hygiene, water, sanitation, and hygiene. We are looking at access to safe potable water and sanitation and also hygiene practices, which are lacking at the moment and need for increased efforts to reduce such kind of issues. Thank you.
Dan, speaking of volunteers, the World Health Organization is sending emergency teams to support Malawi's efforts to contain the outbreak. My question to you is, how critical is this support?
Very much important, indeed. And the support has come at the right time when we really need this kind of support. Let me just mention that the increased number of deaths that we are seeing at the moment is mainly due to delayed case management or delayed access to critical clinical care. So in this case, what I'm saying is the communities or the patients are coming to facilities when they are already severely dehydrated. And this leaves a situation where health workers are not able to manage such kind of cases, and later on we are losing these lives. So in terms of bridging the chain between the community and health facilities, oral rehydration therapy is one of the critical area that we can look at. Like the volunteers should be able to provide oral rehydration salts in the communities, be able to assess dehydration among patients, and also provide the rehydration service before these people reach the health facility or cholera treatment unit. This, I hope, is going to save a lot of lives in terms of reducing the number of cases or the number of deaths that are rising at the moment.
All right, Dan.
So this support is...
Dan Banda, thanks for that. Let's leave it there for now. We hope Malawi gets all the help that they need. Dan Banda speaking to us via Zoom from Malawi. Thanks for that.